This is CNN.
Everyone, and live from Washington, D.C. with CNN Health, my name is Roger Call, and I will be your news correspondent for tonight. Given the rise of preterm births we've seen in this country and around the world, we now have another epidemic on our hands that needs to be addressed. So tonight with me is Dr. Ankita Mishra from the World Health Organization, where she currently runs the preterm birth portion of the organization. There has just been so much going on, and she's here to help address and help give us solutions to solve this crisis. So the first question I have for you, Dr. Ankita Mishra, is what exactly is a preterm birth?
Thank you, Dr. Hall. Preterm birth is actually defined as infants that are born at or before 37 weeks of pregnancy. A typical pregnancy usually lasts about 40 weeks. If infants are born preterm, this could lead to severe health problems such as jaundice, vision loss, cerebral palsy, and intellectual delays.
And given this knowledge that you've given us, how prevalent is this in today's society?
This is actually a very severely prevalent issue. Both the CDC and March of Dimes claim to say that preterm birth is the leading cause of death among children that are 5 years and younger. This causes 1 million deaths, and we lose 2 children every 2 minutes throughout the year due to this. There's a higher rate of preterm birth in America as compared to the Philippines, Democratic Republic of Congo, and Bangladesh, which are all considered to be developing countries. We have the resources and research to fix this problem, so we need to come together as Americans and fix this disappointing tragedy that affects 1 in 10 American infants.
Thank you for that information, Dr. Mishra. Now, you mentioned 1 in 10 Americans are affected by this. And with that being said, is there any particular group who may be affected more than others within our country? And if so, what can they do to help reduce that risk?
Yes, there definitely is. Over 45% of preterm births occur in the African American population, and this could be reduced by 3/4 through current cost-effective interventions to bring access to care to all Americans. What we need to do is provide essential care to mothers and babies through nutritional and educational programs to support their psychosocial and preventative care needs. We need to work to mobilize healthcare, and we can do this through the support of Medicaid and other programs to work at a community level and eradicate this problem.
And that is extremely important given the current time we're in with our health system. And so my next question for you is, what exactly can these programs be done to be implemented currently within our socio-economic and political system, if they can?
Actually, they are currently possible. The March of Dimes has an extensive and powerful network of committees that can work as a workforce to enact a prevention method. Through the research that the CDC and World Health Organization have conducted, we can use the March of Dimes as a grassroots organization that can work to reduce the prevalence of preterm birth in both the African American population and through the entire population. We can work to eradicate this disparity through the March of Dimes.
Well, thank you, Dr. Mishra, for all the information you have given me and the American public. We have nothing else left for you tonight, folks. Tune in and stay seated tightly for the next segment. Thank you and have a great night.